I'm Melissa Chalker, Executive Director of the New Jersey Foundation for Aging. Welcome to Aging Insights. In our last two episodes, we spoke with experts about the long term and lasting impacts of COVID 19. And something that kept coming up is concerns about social connectedness and how we can stay in touch with our family, friends, and community during the pandemic. So we thought we'd explore that a little bit more. Today, I'm joined by Alison Thomas-Cottingham, an associate professor at Rider University and a researcher with Sabre 88, to talk more about social connectedness and the negative impact that social isolation can have on all of us. I'll also be joined by Karen Alexander with NJTIP to talk about how providers had to adapt and rethink access and mobility for individuals in their communities. So, Alison, welcome back to Aging Insights. You joined me in 2019 to talk about social isolation and its impact specifically on older adults. And I'm so happy to have you back with me today to revisit that conversation. But before we get into all of that, if you could remind our audience who you are and a little bit of your background.
I am an associate professor in the Department of Psychology at Rider University in Lawrenceville. I'm also a principal investigator at Sabre 88 in Newark, New Jersey.
You do bring such a wealth of knowledge with you, and that's why I'm so grateful that you had time to join us for this conversation. As I mentioned the last time you were here, we did talk about social isolation and specifically the research that's been done and the negative impact that it has on one's health. But if you would just remind the audience also what we mean when we say social isolation and what that might look like for people.
First of all, social isolation, which we have to say very slowly and deliberately, social isolation is as dangerous to one's health as being obese, as smoking, as being physically inactive. Older adults who report being socially isolated are more likely to die sooner than those who don't report being isolated. They're also more likely to experience declines in mobility. And they're also at increased risk for mental health conditions, including depression.
Mm-hmm.
And so one of the things that, I also want to make really clear is often people will say social isolation and then they'll say loneliness as if they're the same, and they're not the same thing. They're similar, but I want to make like a distinction. So social isolation is quantitative, it's objective. It is very easily measured. Often researchers will ask people about the number of contacts they have in a period of time or the number of friends in their social group. And so we can measure whether or not someone is socially isolated. Loneliness, on the other hand, is subjective. It's qualitative. And loneliness is a person's personal perceptions of feeling that they don't have adequate social supports. And so loneliness is a more personal thing that varies from person to person, whereas social isolation is more objective. And a really nice way to kind of merge the two is we all know people who are alone, but they're not lonely, right? So you can be a person who lives alone and enjoys your alone time and looks forward to the end of the day when you go home alone and it's quiet. Being alone is not the same as being lonely. So there are people who can be alone and they're not lonely. And so we're going to talk about social isolation, but I'm going to kind of lump them. And really, I'm talking about people who are alone and are not happy about being in that state and the negative effects that it has.
Sure. I think last time we talked about one of the risk factors being that people who live alone, that people who live alone are more at risk for social isolation. But you make a really good point between those two. So thank you for doing that. As I said at the open of this, COVID-19 has had a great impact on this issue in general, and we've heard it talked about in mainstream media where people didn't talk about isolation before or that lack of social connectedness. So how or why has this become a greater issue because of this?
So we are now at a point in time where we're dealing with sheltering in place. We're dealing with people who are quarantined. And so I feel like now more people have an understanding of what it's like to be socially isolated.
Mm-hmm.
And, people are talking about young adults who are, living in dorm rooms and taking classes from dorm rooms, and meals are delivered to their dorm rooms and they don't leave. And so
Hmm.
I feel like with all that's happening with the pandemic, we are now, most of us are at a point where either we have a personal experience with quarantine or our own social isolation, or someone near and dear to us has that experience. And so I just feel
Hmm.
like we now are all at a point where maybe we're better able to demonstrate some empathy because we are seeing it, we are living it. And when it comes to older adults, it's really interesting because we know older adults are at greater risk of infection, right? So we have the list of folks who are at risk, right? And older adults are on that list. And so as a result, what we're doing in an effort to protect them is we're putting them away, right? So we're having them, we're moving them away from everyone else, and it's something that we're doing to help them to reduce the likelihood that they'll get infected. But in doing that, we're also placing them at greater risk for all the negative outcomes
Hmm.
associated with social isolation. So we're cutting them off from the virus, but we're also cutting them off from friends and loved ones,
Hmm.
which is a
Yeah.
problem.
It is absolutely a problem. We want everyone to remain safe and healthy, but we also want them to be conscious of their mental health and of their emotional well-being. And so that's just as important. So as we explore all the whys and the hows, and we I think have a basic understanding now of the impact that social isolation has, I'd like to shift a little bit to talk about how we can overcome it.
So there are these three objectives, or these three things to keep in mind when we're trying to fight social isolation. The first thing that we can do is we can increase the frequency of our social contacts, right? And social contacts, I love, like, at some point you sent me something and you said physical distancing. And I love when people say that instead of social distancing, right? Because yes, we are physically separated, but we don't have to be socially separated or socially apart. And so there are all sorts of things we can do so that we can have frequent contacts. So increasing frequent contacts is one thing. Another thing we can do is increase the size of our social network. So introduce more people into our social network. And we're going to talk in a little bit about some interventions. And some of those interventions will provide examples of people who are doing things so that they have more people in their social network, their social circle. And the last thing is to improve the quality of social supports. And so, having a social contact is important, but it also needs to be like high quality social contact. And so calling someone to say, hi is one thing, but calling someone to say, hi, how are you? Can you tell me about your day? I'm interested in what's going on with you is another thing. So increasing the frequency of social contacts, the size of our social network, and the quality of our social supports is hugely important.
You mentioned that we would get to some specific interventions. So do you want to, start talking
Yeah.
about that kicking it off with this option of virtual connection?
So New Jersey is really varied, and different programs work in different locations. And so New Jersey has put together a whole bunch of programs that are really innovative to help older adults who are dealing with sheltering in place and possibly dealing with feeling isolated or feeling lonely. And so the first one that I want to talk about is telephone reassurance. And so that's the thing that I talked about a moment ago, calling someone not just to say hi, but to actually talk to them. How are you doing? To provide them with some, information about maybe other programs, to provide information about nutrition services. But this whole idea of connecting with someone on a regular basis is something that's really important. So telephone reassurance was a really nice one. And then there are these really creative things, like some senior buildings are now doing something called doorway coffee and cake. where seniors, so first of all, we all know we love the smell of coffee in the morning, right? And
Mhm.
so what they do is they brew a big urn of coffee in the hallway to get the smell going in the building. And then residents sit in their doorways and they drink coffee, and they're 6 feet apart from each other, but they get to engage and have conversation in the doorways of their buildings. And so it gives them a chance to connect with the other people in their building.
Mhm.
Similarly, some senior centers are doing doorway bingo. You know that there are all sorts of classes that are still being offered, but virtually. So a lot of senior centers are still offering Zumba, and they're still offering computer classes and Italian and all sorts of language classes. And again, it's virtual. And I know one of the things that we do in New Jersey is we have these nutrition centers where seniors go, and it's a senior center that provides meals as well. And I know for some seniors, these nutrition centers are not only the main source of a meal and they rely on the meals they get at these nutrition centers, but I know also for some seniors, these nutrition centers are the place where they actually get to see their friends and they get to interact.
I did want to also, just because go back to something you said earlier about the difference between loneliness and social isolation, because one group we haven't talked about yet is caregivers.
Caregivers are at great risk for all sorts of negative outcomes, including mental health um, struggles. Because again, I think you said it, you think, okay, they're not alone, they're with another person, but the quality of the relationship, depending on the condition of the person for whom you're providing the care, it may not be a reciprocal sort of relationship where you're getting a lot of support, or maybe the person is unable to communicate. And so I think people make the assumption, oh, they're not alone, they're with they're with their spouse, right? But that relationship may not be one that provides a lot of support. In addition, when you think about caregiving, caregivers make huge sacrifices, and so I think that we need to also think about caregivers and what we can do for caregivers as well.
Well, I really think you've shared a lot of great information with us and given our audience a lot to think about, Alison. So I appreciate that. And just in wrapping up, I want to tell people, if they're feeling isolated, to reach out, to call for help, whether it's a family member, a friend, as I said, or there's some great programs and opportunities. And the best place to start is your county office on aging or your local senior center, because not only what they provide, but who else they can connect you with if you need mental health resources or other things. So
Definitely,
yeah.
definitely. The resources are out there.
Mm-hmm. Great. Thank you so much, Alison. This has been a wonderful conversation. I
Thank
appreciate your time.
you. Thank you.
Alison gave us a lot to think about and offers some great suggestions about staying connected. However, we might still be thinking about how access and mobility factor into this conversation. On our next segment, we're joined by Karen Alexander to talk about how technology can be used to help transportation and other providers adapt during the pandemic. Hi, Karen. Thanks so much for joining me today. I'm really happy to have you here so we can have a conversation about transportation and mobility and all kinds of great things. Can you first tell our audience a little bit about yourself and about the work that you do at NJTIP?
I'm the managing director of NJTIP at Rutgers, and we are the New Jersey Travel Independence Program. Our mission is to teach older adults and people with disabilities how to use the public transit system and other mobility options in New Jersey. We've been part of Rutgers for the last 7 years, but the program started in 2005 with a pilot that New Jersey Transit sponsored to see if there were folks who were on the Access Link system who might be able to use the fixed route system if they had the right training and coaching. And that pilot was successful. It became a little nonprofit. And then that nonprofit got absorbed into Rutgers in 2013. Today, we have services in 12 different counties. We have 461 people who've graduated from our one-on-one training program, and about 12,000 that we've trained through group settings, meaning older adults, people with disabilities, and then also we work with counselors, teachers, professionals who work with those populations to help them learn about the transit system as well. And In 2017, we did a follow-up with our graduates, and the 55 people who graduated that year, we found that 88% had used transit after we completed training with them, and about 55% a year later reported that they'd used a bus or a train or a route beyond what we trained them on, that they
Wow.
figured that out independently based on the
Right.
training they got from us.
Right.
So we're really proud of that in terms of really increasing the independence and
Mm-hmm.
mobility and opportunity for the people
Yeah.
that we serve.
Yeah. And so we know that obviously COVID-19 has probably thrown a wrench in that plan. And so how has your team been operating and responding since COVID, and what options are there for travel training at the moment?
So, like everyone else, the world turned upside down for NJTIP in March. And we quickly adapted to a remote and virtual training model. Some of the nonprofit folks that I talked to in New Jersey used the phrase, the future came faster. And I think we experienced that as well. And by April, we were able to start doing remote and virtual travel training with individuals and with groups, and incorporating the guidance from the CDC in terms of physical distancing, proper hygiene, safe community skills, and how to use a mask, of course, and wear it properly. We were not on vehicles. We were following the governor's orders. But we created a whole curriculum that could be delivered via platforms like this instead of in person. And then I'm pleased to say by the end of September, we were able to go back out onto buses and trains and do in-field training. We had adapted our curriculum to include COVID-19 safety guidance. And we are able to provide limited travel training in the field for what we call essential trips at this point. Most of our training is being done virtually and remotely. But when you get to the point where there's a job or a class or a caregiving responsibility or a medical appointment, we will go out into the field and make sure you really have those skills to do it safely.
Yeah.
And we hope to continue to do that.
Yeah. There's so much that everyone is dealing with and learning and adapting to, right? And a lot of the work that you do, while it focuses on transportation, is really about mobility, right? It's really about people's ability to get to things, services, places. As we think about, as you said, the future coming sooner, how has that view changed because of COVID?
Yeah, I think that's a really good question, Melissa. And it's certainly something that you and I have talked about over the years. We've always said if you can't get to it, it doesn't exist for you. And our experience with the pandemic has really turned that around into if it can't get to you, it doesn't exist for you. And we've really seen that over the spring and summer. Some of the examples I've been looking at in terms of this question of access versus straight mobility are things like there are transit systems throughout the country that were parking Wi-Fi buses in neighborhoods so that kids could go to school who didn't have internet access. That kind of portable access could be stationed outside senior housing buildings so that older adults who may not have internet access could get telehealth access and order groceries and participate in online activities, in terms of virtual visits and worship. There's no reason we couldn't adapt that to other populations beside schools and the school day. Another one that I think is interesting and that we've seen sort of a version of here in New Jersey. In Seattle, they have what's called a civic coffee hour, where older adults meet virtually with civic leaders to explore programs and services. And they do it on Microsoft Teams so that it can be captioned in multiple languages. So you're creating the civic engagement via online platforms. And I think all of that's really interesting in terms of making those connections. I think the last thing to just sort of point out is when you look at the travel patterns of older adults, people over the age of 75, we tend to focus on medical trips, but when you look at the National Household Travel data, what you see is most of those trips that they're making are for shopping and errands and social and recreational trips.
And that's, it sounds like technology has played a major role in a lot of these things. And how can we anticipate that will continue to help people not only, as you said, get the things they need, like groceries and things, but also that medical care and social interaction as well?
Yeah, I think, part of it is we can start with making the internet more affordable so that mobility substitutes are more in the reach of people in terms of trying to meet those underlying needs for healthy food and visiting with friends and, getting the right medical care when they need it. And I think, you know, technology is changing really rapidly, and it's changing in ways that also affect older adults. There was an article in the Wall Street Journal a couple of weeks ago called 25 Ways 2020 Changed How We Use Technology Forever. And some of the things that jumped out to me was that Zoom calls went from 10 million per day in December to 300 million per day by March. So a
Wow.
30-fold increase. The
Wow.
American Psychiatric Association reported that pre-pandemic, patients used telehealth 2% of the time. By summer, it was almost 85% of the time.
Mm.
And you look at things like online grocery sales that went from 1.2 billion in June to 7.2 billion by
Mm.
June of 2020, a 600% increase, right?
Yeah.
So all of this technology is happening and is being promulgated, but we have really ageist assumptions about technology use and adoption.
Mm-hmm.
And I think we really have to challenge that. The Pew Charitable Trust released some stats from 2019 that showed 91% of people over the age of 65 have a mobile phone.
Mm-hmm.
And that's not always a smartphone.
Right.
91% have a mobile phone and 73% use the internet.
Mm-hmm.
So we have this preconceived notion that this is very out of reach. And while it is out of reach for some older adults, a big part of the cohort actually has access.
Mm-hmm.
And we have to be real, doing it virtually is not the same as doing it in person.
Mm-hmm.
It's different.
Mm-hmm.
But one senior I recently spoke to at a coffee hour that was being held by Westwood, age-friendly Westwood,
Mm-hmm.
talked about going to a one-year-old's birthday party and going to an 80th wedding anniversary celebration. We made her repeat it on another continent with
Yeah.
family on the continent. And
Mm-hmm.
another described sitting Shiva with a friend who'd lost her spouse. And the friend lives much further away than she would ever be able to go and actually do that in person.
Mm-hmm.
So, I have this suspicion, and I work at Rutgers. It's a research institution. This is just a gut feeling
Mm-hmm.
that many seniors' first experience with Zoom may have been Easter or Passover.
Mm-hmm.
And when you think about it, there was a specific need, there was a high level of motivation, and there was probably intergenerational support
Mm-hmm.
to help make that happen.
Yeah.
And we have to look for those features. Once the technology bridge is built, the transportation isn't a barrier anymore.
No, it's great. Those are all wonderful points, and I think that it's as you said, the future is here already, right?
The future came faster.
The future came faster. It sure did. I did just want to go back briefly to in the beginning. You mentioned that as part of your travel training, that sometime in September you did actually get back on buses and trains, and so I wanted to see if you could tell us a little bit about how New Jersey Transit has been operating and what people can anticipate in terms of COVID precautions on public transportation if they still need to take it.
Yeah, absolutely. So we did go back out, using guidance from the governor, the CDC, Rutgers University's own guidance to focus on being safe in the community and on transit. Early in the pandemic, there was concerns that public transit was a hot spot, but the research subsequent to that has shown that's not the case. It's, being on transit in and of itself is not a thing that's a high risk thing. But you have to be careful and you have to follow safety protocols. You have to keep your distance. You have to wear a mask. You have to wash your hands, just like you would in any other place going out in the community. And really focusing on lower contact options, things like purchasing your ticket using a phone app. There's great guidance on the New Jersey Transit website. They have a whole section called The Road to Recovery, and it lays out all of the things one might want to consider when going out. What we have seen is that essential workers are still using transit, especially here within the state. And I heard a report from Kevin Corbett, the executive director at New Jersey Transit, at a meeting last month, that he said in September, local bus service was back up to 70% of the pre-COVID levels, and light rail was about 55%. Well, rail service into New York has seen big ridership declines. A lot of those people are able to work virtually. Essential workers, the people who, stock the grocery shelves and, keep the buildings open, those folks are traveling locally and they're using buses and they're back on those buses. Um, a couple of things I can say in terms of using the system safely. One of the features New Jersey Transit has added recently to its app is a feature where you can see how crowded your bus or train is that you're thinking of taking. So you can see if it's red, green, or yellow. And if it's a bus, there's another one coming in a few minutes, you might want to wait for the next one. And now you can have that information literally in the palm of your hand. It's part of the mobile app. Um, so they get that people are concerned and, wanting to do things safely and trying to put technology into the hands of their customers so they can make good decisions about being out and about safely.
Karen, before you go, anything else you want our audience to know?
Yes. First of all, I just want to make sure folks know that if you're over the age of 62, you can use reduced fare, showing your proof of age. And that immediately saves you 50% on the bus or the train. And that's really important in terms of using that anytime and all the time that you might want to travel on New Jersey Transit. Every local bus is accessible. 95% of the light rail is accessible. Every train is accessible. And about half of the train stations are accessible. So there's good reason to go and try to use that. And another sort of piece I just want to share is in August, our governor signed a piece of legislation that makes anyone who has Access Link automatically eligible for that reduced fare benefit. Of course, NJTIP, given what we do for a living, we're happy and eager to help folks who may want some coaching or advice on how to use that. By all means, to contact us.
Yeah. I was going to say we should tell people how to get in touch with NJTIP. So what's the best way?
Sure. Our website is NJTIP.Rutgers, RUTGERS.edu. And we actually have a referral form right on the website if you're interested in learning more about what we do. And we do have a phone number, even in these days. The phones are forwarded, and that's 848-932-4499.
Great.
Melissa,
Thanks.
thank you.
Thank you, Karen. This has been wonderful. Thank you for watching this episode of Aging Insights. For more information and to watch previous episodes, please visit our website at www.njfoundationforaging.org. We hope that you found this episode helpful. Please know that there are resources out there for you if you're dealing with social isolation or if you need access or information about transportation. If you or a loved one need assistance, please call the mental health hotline at 1-866-202-HELP. That's 1-866-202-4357. To learn more about transportation and how to ride public transportation safely, please visit njtransit.com or call them at 1-800-727-2287. And do feel free to reach out to Karen and her staff at NJTIP by finding them online or giving them a call at 1-848-932-4499. And remember, another source of information and connectedness during this time is your County Office on Aging. You can find their numbers on our website, or you can call the state hotline at 1-877-222-3737. And please, wear your mask, wash your hands, and stay a safe physical distance, but remain socially connected.